Hello listeners, welcome to Views on Health. A great pleasure to have with me on the program tonight Dr. Nilangika Sandakumari, who is a consultant physician at the University of Sri Jayawardhanapura. A warm welcome indeed to you, Doctor, because this is the first time that you're being featured in this series of programs.
And today I have selected a topic which is very relevant to the community in Sri Lanka. I would like to talk a little bit about medications in diabetes.
In fact, Doctor, diabetes, as we know from a lay perspective, you're the medical specialist, I'm on the other side of the fence, so to speak. But from our perspective, it is a serious issue, the way we hear, what we get to know. And in my case, by engaging with the consultants week in, week out on various aspects of medical issues, diabetes does come into the picture, so to speak, that it is a problem that many Sri Lankans are faced with. And putting childhood diabetes to aside, that again is a big problem that Sri Lanka faces. But then thereafter you get the young adults, then the middle age and the older people. So it is a huge problem in Sri Lanka. And so many consultants like you have addressed this problem. Despite that, back again, when they come here and they're before the microphone, they say the problems have not actually receded. You're seeing more patients, not lesser patients.
Yes, now it's actually diabetes. It's a global burden, and there's a worldwide rise in the incidence of diabetes. What we saw a few years ago is not seen today. It was actually elderly community. It was a few years ago, elderly community was the vulnerable target group. But now it is seen more and more in childhood and in younger generation. So this is something that we need to talk about every day. So when it comes to diabetes, you have three main types: type 2, type 1 and gestational diabetes. What are these types? Type 1 is the one that you get at a relatively young age, where you will not have insulin hormone in your body. That hormone will not be produced. That is type 1. When it comes to type 2, which is more prevalent than type 1, you have insulin, but it doesn't work properly. That is the most common type. What we saw a few years ago was type 2 diabetes in adults and elderly people. But now gradually it has started to affect the younger generation as well. So type 2 is now seen even in school children, even in young adults. And the gestational diabetes is the one which affects the pregnancy. It is only seen in pregnancy, and once the baby is delivered, the diabetes disappears. So both the type 1, type 2 are more common now, but we are mainly focusing on type 2 diabetes, which has a rising trend, plus our lifestyle changes. In the recent few years, I think now we are moving away from our agricultural based lifestyles. Now most of us are working in the offices, and stress is a very common association with everybody. So the prevalence of diabetes has also gone up. Even if you take a school child, they are stressed up with their academic activities, not only at the schools, but they are engaged in tuition classes and all that, and exam stress. Everything has contributed to this global burden. So it's in rising trend, and we need to address this. I think before going into the medications, if I am to tell a little bit about the lifestyle modifications, which I think must have been talked before, but still it's worth reiterating the facts. Lifestyle modifications must include daily exercise, daily aerobic exercise. Now, if you go to your workplace in the morning, and if you're seated all the time there, and go back home and then watch television and go to bed, you are not using your muscles, you are not burning your fat, so that is not good for your health. We are meant to physically work. So you have to exercise at least 15 to 20 minutes. I'm not telling you to go to a gym to do this. You can go for a brisk walk. You can either run or you can do a sport which you like swimming. So 15 to 20 minutes is more than enough. Not necessarily an hour or two. Hour or two is actually too much on a daily basis. If you can't find time, I'm very sure that 15 minutes is not a very big issue for you. So find 15 to 30 minutes and then do that. It must be an aerobic exercise. And pay attention to your meals. It has to be less sugary and less starchy food with full of vegetables and legumes. So those are the dietary plus lifestyle modifications. But when it comes to a stage where these alone can't control diabetes, you have to go for your medications. Today we are going to discuss about those.
Thank you, Doctor. This is a very nice introduction to the problem that we're going to discuss. That is medication in diabetes. So now basically, back again from our lay perspective, we know that doctors prescribe certain drugs that are taken on a regular basis, and there have been doctors who have complained that the patient will either take one set of medicines that are prescribed and then not come back to see the doctor again, or that particular patient might just self-medicate thereafter, thinking I don't need to see a doctor, what he or she gave me, and if I continue this, I'll be good. Whereas that's not the situation. Because you have to monitor, and
Of
accordingly
course.
you will say you either increase or reduce or change the medicine, so many things that a doctor will do.
Yeah, of course, in diabetes, it's something that you have to live for your entire life. When it is there, it's not like a fever. It doesn't come and go. There's no actually a permanent cure for diabetes. It's a state of control where you will have to take medications and monitor your blood sugar levels and adjust your medications accordingly. So when you go to your doctor with your first high blood sugar value, we tend to start on a drug named metformin. I think most of our listeners are familiar with this. Metformin is the first line medication for diabetes. So when it is started, the doctor will instruct you how to take your meals and when to take these medications. Usually these drugs are taken with meals, either with meals or after meals. And it is very important for you to monitor your blood sugar levels at a given frequency. It can be either fasting blood sugar levels, or we have another blood test to assess long-term control of diabetes, which is called HbA1c levels. So by doing those blood tests, you have to see whether your control is okay, and your doctor will instruct you when to come up with these blood tests. And the other important thing is medications must be taken on a regular basis. You must not stop them without your doctor's advice. And while you're taking drugs, you must take a balanced, regular meal. Now, some people, they tend to think, because I am on these drugs, I can now eat abundantly, or a little bit of sugar won't do any harm, but that's a myth. You have to take a healthy diet with less carbohydrate and less sugar levels. But you can't skip meals as well. If you skip meals while taking these drugs, then your blood sugar levels will go too low. But metformin will never cause your blood sugar levels to go beyond the normal level. It will anyway, if you are taking only the metformin, it will keep your blood sugar levels above the cutoff level, the low level. But the other diabetic medications can even drop your blood sugar levels below normal. So it is important to take a regular meal which is having adequate amount of carbohydrates but not in excess, and it has to be, you must not skip your meals. Now some people, they do think, my doctor advised me to go on a diet and he advised me to control my weight, so I will not take my dinner, I will not take my lunch. That is not a good advice, good practice to do. You must take your meals in a proper way. You have to pay your attention to the consistency of the meals plus the quantity. That doesn't mean omitting meals is a good habit. You must not skip meals. So apart from metformin, the other drugs that can be taken by mouth include some new drugs named sitagliptin and empagliflozin. So empagliflozin is something very new to Sri Lanka. It was last 2 to 3 years we started prescribing empagliflozin in our country. But now we are prescribing it to almost all the patients who find it very difficult to control with metformin and one more drugs. So what does this drug do? The new drug empagliflozin, what it will do is it will inhibit your glucose getting absorbed from your urine. Now in a healthy person who doesn't have diabetes, all the sugar that is filtered in by the kidney into the urine will get reabsorbed into the body. What this drug will do is it will inhibit that reabsorption. So sugars will get excreted, go out of the body with urine. So it's a safe drug. It will not have unwanted side effects apart from one thing. Now as you can understand, this drug will cause lot of sugar in urine. So sugar is a good culture media for the bacteria to grow. If you take this drug, the bacteria, there's a chance bacteria will survive in sugary urine, which can cause urine infections. So if you are prescribed with this drug, if you are on empagliflozin, you must drink plenty of water. Empagliflozin is a very good drug. It's a new drug. It will help to control your HbA1c levels and blood sugar levels. But it's very important to remember to drink plenty of water if you are to avoid urine infections. So other than empagliflozin, now research studies, they have shown this new drugs is very beneficial in patients with diabetes and ischemic heart disease. Now most of the time you see patients with diabetes, they concomitantly have ischemic heart disease, hypertension and kidney problems also. So this is the effectivity is more in patients with, they have other benefits in patients with ischemic heart disease along with diabetes. So that is a new drug, right? And other than that, we have sitagliptin. It is also relatively new, but it came into practice before empagliflozin. Sitagliptin is also a drug which will increase our insulin secretion from the body. So you have plenty of, in the past years, older days, we had only metformin and glibenclamide to treat diabetes. Metformin and another drug group of drugs called sulfonylurea, where you find glibenclamide. But now there's a lot of advances in medications. You have sitagliptin, you have empagliflozin, all are available in Sri Lanka now. And even you have some injectable drugs. Other than insulin, you have injectable drugs. So you have a lot of remedies for diabetes now. The only important thing is that you need to adhere to the plan given by your doctor. You must not stop your drugs haphazardly. Must adhere to what your doctor wants you to do. So he will control your diabetes.
Thank you so much, Doctor. That's interesting because now if there are advances in medicine, in terms of medication rather, then obviously it augurs well for the patients. But then there's always a proviso that they have to follow medical advice, which I think unfortunately is a problem in Sri Lanka. In the sense you come across so many doctors who say that patients don't adhere to medical advice, which is unfortunate. How much you tell them, they tend to, after some time, just let it go. Yes. And then then there'll be a setback, or there could be some sort of complication.
Yeah. So diabetes is a disease where if you don't control it with these medications, can give rise to a lot of complications. That is, complications are multi-system wise. It doesn't affect just the kidney, just the heart, but it will affect almost all the organs in the body. If you don't control it very well, it can result in a stroke. So if it gives rise to a stroke, the rest of the patient's life may be like, it's a bedridden, it can end up in a bedridden patient. And then it is an independent risk factor for heart attacks. And also your kidneys are affected by diabetes. At the very first stage, you will notice when you pass urine, there's some froth. But when the kidney damage is advanced, then your kidneys gradually get damaged and your legs start to swell up. You find it difficult to breathe. That indicates that the kidneys are progressively being damaged. And also your legs, feet. Most of the diabetic patients, when they present at first to the medical clinic, they feel numbness of their feet. That is because their nerves in the feet are being affected by the uncontrolled sugar level. And also there are visual problems with vision. Eyes are affected. So it's not a single disease like a fever or cirrhosis or something which affects just one organ. This can affect all the body, all the organs in the body, and can end up in a really unwanted, unpleasant experience if you don't control it very well. But the good side of it is, if you control it very well, you can spend the normal lifespan person who without diabetes can spend. It will be the same. If you control it properly without any complications, you can spend a very good healthy life like a person who doesn't have diabetes. So important to adhere to medications.
At which point does insulin come into play?
Yeah, insulin is something now for this year, it's 100 years after inventing insulin. So insulin is needed from the very beginning for patients with type 1 diabetes. I told you that there's a type of a diabetes which is not very common as type 2 diabetes, but where there is no insulin at all. Then that is more common in younger population, even in children. If you diagnose it as type 1 diabetes, they don't have any insulin. So from the very beginning, they have to take insulin. But in type 2 diabetes, when you find it very difficult to control with the oral drugs, then you add a little bit of insulin. That insulin can be a long-acting one or a short-acting one. Long-acting ones, usually we give it either in the morning or at night to keep your basal insulin secretion. But short-acting insulins, you give it to cover the main meals of the patient. Now, as you know, after a meal, your sugar levels go up. So you can give a short-acting insulin to cover the main meals, either with the 3 main meals, or you can combine the short-acting insulin with the long-acting insulin and then give it twice daily in the morning and afternoon. Anyway, when you're giving insulin, again, it's very important to remember certain facts. Now, insulin can be, now it is an injectable drug. You can't take insulin by mouth. If you take it by mouth, it's a protein, it will get digested. So there's no way of giving insulin by mouth. It's an injectable drug. You can inject it either with a needle, or you have now pen devices, insulin pens. You can select any one of these. So very important to take the exact amount prescribed by your doctor. If your doctor has prescribed only 10 units in the morning, just withdraw 10 units into your needle and inject into the site that you were instructed to. If you withdraw more than that, or if you carelessly withdraw the amount more than that and inject it, it will drop your sugars to like the very to below normal level. So what will happen then? Then we call it medically hypoglycemia. You will have very low sugar levels. You will start to feel dizzy, and you will feel that your heartbeat is faster, you will start sweating, and then you know that your sugar levels are too low. Immediately you have to take something which contains sugar. So very important to withdraw the exact amount prescribed by the doctor. And then when you're injecting, you have 3 sites to inject. You can inject it either to the mid 1/3 of your arm, either side of the arm, or to your thigh, either side again, or to your tummy, the front wall of your tummy. So 3 sites are there, but you can't inject to 3 sites haphazardly. If you inject to the arm today, tomorrow also you have to inject to the same site. Otherwise, insulin absorption will be erratic. So it has to be for the same site, but don't inject the same point. You have to rotate it. Rotate around that point, but to the same area. If it is arm, inject insulin continuously to arm for about 2 months. Then rotate the site. Go to your abdomen. Go to your thigh. If you inject it to the same area every day, you will develop a big lump. We call it lipohypertrophy. Lipids, the fat layer will come up like a bump, and it will hurt. It will be ugly to look at. So important to rotate the site, but first 2 or 3 weeks to a single site, and then move on to the other side. And then how to store your insulin. So insulin needs to be kept in a refrigerator and in the door compartment. Don't freeze your insulin. Don't keep it in the deep freezer. And now insulin pens, actually you can keep it in an AC room even. Like that, storing insulin is also important. So when you're taking insulin, you have to make sure that you are checking your blood sugars regularly, and then you are documenting it and showing to your doctor. And as advised by the doctor, you need to adjust the units or the amount of insulin that you are taking. So that's about insulin.
Thank you, Doctor. That's very interesting, because patients who are into giving their own insulin, I have seen my friends do it. And so this point about rotating the site.
Yeah, that is very important.
Arms or stomach or the thigh.
Yeah.
Say for about 2 months, you said.
Yeah. You can select one site and inject for 2 months to that
site. That is every day?
Every day.
Twice a day even?
Twice a day to the same site, but to different points. And then at the end of 2 to 3 months, you can go to another site. If you change the site on a daily basis, your absorption will be different. Absorption from arm is different from absorption of your tummy. Absorption from tummy is different from your thigh. So the dose that enters to your blood will differ from the site that you're selecting. So it has to be consistent for a period of time. Then you can move on to another site.
And when the injection is taken, you do it yourself. Is the sort of effect of it immediate? Because it goes into the system.
Insulin effect. Now, insulin usually, if it is a short-acting insulin you are taking, it has to be taken 20 to 30 minutes before your meals. Then, in about half an hour, its effects start to come. So, then after 30 minutes, you have to take your meals. If you don't take your meals after 30 minutes, you will be hypoglycemic, or your blood sugars will go down drastically. Insulin will directly enter into your bloodstream, and then blood sugar levels will quickly come down within about half an hour. So very important to take your meals after injecting your insulin, after about 20 to 30 minutes injecting your insulin. Effects are immediate.
Thank you, Doctor. Time has caught up with us. What is your take-home message?
Yes, my take-home message is diabetes is steadily increasing. It's something that you need to be updated on an everyday basis, daily basis, and very important to continue your medications as prescribed by your doctor, along with lifestyle modifications and your diet.
Thank you, Doctor. On that note of advice, we end this interesting discussion. on medication in diabetes. And thank you very sincerely, Dr. Nilangika Sandakumari, Consultant Physician, University of Sri Jayawardhanapura, for being with us on the program and sharing your expert knowledge with our listeners on this very important topic. Thank you, Doctor.
Thank you very much for inviting me as well, and
Our
it's a
pleasure.
pleasure.
My thanks also go to Nadira Manamperi for technical assistance. I'm Fatima Razi Kadi saying good night and looking forward to being with you next Monday, same time on Views on Health.